Hey, health warriors. Every 40 seconds, someone in the United States has a heart attack, and recognizing the signs quickly can mean the difference between survival and tragedy. Today, we're breaking down myocardial infarction, or heart attack, how to identify it, what labs and tests confirm it, and the emergency steps that can save lives. A myocardial infarction, or MI, happens when blood flow to part of the heart muscle is blocked, usually due to a blood clot in a coronary artery. Without oxygen, the affected muscle begins to die fast. Early recognition and rapid intervention are critical. Common signs and symptoms of a myocardial infarction include chest pain or pressure, often described as an elephant sitting on the chest, radiation of pain to the jaw, arm, or back, shortness of breath, nausea, vomiting, sweating, and anxiety. It's important to note that women and diabetics may experience atypical symptoms such as fatigue, indigestion, and dizziness. Let's compare STEMI and NSTEMI. In a STEMI, or ST elevation myocardial infarction, the full thickness of the heart muscle is affected, and ST elevation is seen on an EKG. Immediate reperfusion therapy like PCI or thrombolytics is needed. In contrast, an NSTEMI, or non-ST elevation myocardial infarction, involves partial thickness damage. There's no ST elevation, but elevated troponins are present. NSTEMI is managed with medications and may require a cath lab based on the patient's risk. Alright, let's talk about the key diagnostic tools. First up, we have the ECG, specifically the 12-lead ECG. This is our first-line tool and should be done within 10 minutes of arrival. Next, we have cardiac biomarkers. Troponin is the most specific indicator of cardiac muscle damage, while CKMB is used less frequently nowadays. Lastly, a chest X-ray or an echo may follow to rule out any complications. Moving on to emergency treatment, we have the MONA protocol and more. M stands for morphine, which is used for pain if it's not relieved by nitroglycerin. O is for oxygen, administered if the patient's SpO2 is less than 90%. N stands for nitroglycerin, given for chest pain, but make sure to watch the blood pressure. A is for aspirin. Patients should chew 162 to 325 milligrams immediately. Additionally, we should consider beta blockers, statins, and heparin. PCI, or angioplasty and stent, should be done within 90 minutes of hospital arrival. If PCI isn't available and the patient is within the time window, thrombolytics are considered. Post-MI care, what happens after? Telemetry monitoring for arrhythmias, cardiac rehab for recovery and education, strict control of cholesterol, blood pressure, and blood sugar, smoking cessation, diet changes, and daily aspirin, and of course, emotional support. Post-MI depression is common. MI care doesn't end with a stent. It continues with prevention, education, and lifestyle change. Bottom line, time is muscle. The faster an MI is recognized and treated, the more heart muscle and life you can save. So know the signs, know the steps, and always act fast. Have you been part of an MI code or rapid intervention? Drop your story in the comments. We all grow through shared experiences. Like, subscribe and follow for more real-world clinical breakdowns that help you think fast and care smarter. And remember, recognize the signs, save the heart, save the life.